COVID-19 pandemic. My name is Josh D'Angelo. I'll be serving as a moderator and a panelist today. And first and foremost, we just want to say thank you. Thank you to everyone at APTA for allowing us to be on the panel today. And thank you to the viewers at home that are joining us. And I know I speak for each of the panelists here today when I say that our hearts and our thoughts are with everyone who has been most directly impacted by the global health pandemic at this time. We know as a community it's more important than ever that we unite and come together. And I'm so fortunate today to be joined by two, potentially three other panelists who are business owners for our discussion. We have Kimberly and Patrick who are joining us. And the format today is that we'll go ahead and first briefly introduce ourselves to provide a bit of background and context to where we're coming from. The second thing we'll be doing is each going around and briefly discussing how we're adapting our clinics to the time of the COVID-19 pandemic. And then really where we're going to spend most of our time is opening up to questions. We want to hear directly from you. So if you have a question about how we're adapting and what we're doing for the clinic and the community, please go ahead and type it in the comments box on Facebook as we go about the Facebook Live. And we hope to answer many of the questions that are here today. At this time, I would love to introduce Kimberly and have her talk to us a little bit about where she's coming from and her background in clinic.
Thank you, Josh. Hey, everyone. One little correction. I'm actually not the business owner for my clinic, but I work at A Step Ahead Physical Therapy in Roswell, Georgia, which is just north of Atlanta. My business owner, my practice owner, his name is Brad Freemeyer. He's another physical therapist. And we are a standalone general outpatient ortho clinic, privately owned. And our practice, we've been open for 12 years. I've been there for 4.5. There's been a long-standing philosophy with our clinic to do health promotion and injury and disease prevention with the community, as well as, of course, with our patients, kind of in a one-on-one setting. So we incorporate in our practice, we have a contract with our local municipality to do injury prevention work with a functional movement screen-based type of program. So we're still carrying that out via telehealth now at this point. But we also do very frequently community health promotion events. So we do injury screenings, injury prevention screenings, and movement screenings. We do workshops both in our clinic and at other places. Like we have a Pilates facility nearby that we've been working with, and senior centers and libraries and stuff. And so we've been trying to find ways to rapidly be able to still reach our community and our patients, as well as a broader community. So that's, should I talk a little bit about what we're doing yet?
Sure, why don't we go ahead into that?
Okay. So the primary thing that I'm still doing to kind of reach everybody, we are live streaming every day, exercise class, basically. This is something new in the COVID-19 era here. So from our Facebook page, which is A Step Ahead Physical Therapy, I put together an exercise program that's about 20 minutes. It's kind of Tabata style, where you're doing 30 seconds on, 10 seconds off, but it's really geared towards people who are not up to all the high intensity interval training and higher intensity, wonderful exercise offerings that are out there right now. Because for those of us who know our populations, most of them are not up to that. So I wanted to make it accessible for people who want to stay active or start to get active, but are just not up to that speed yet. So that's the primary thing that we're doing, kind of extra or adapting how we normally reach the community is in that way.
Great, thank you so much, Kimberly. And just a reminder to all the viewers at home, if you have questions as we go, please leave them in the comment box and we'll make sure to answer them. But at this time, it's my pleasure to introduce Patrick. If you could please tell us a bit about your business and how you guys are responding, that would be appreciated.
Sure, thank you, Josh. My name is Patrick Yin. I'm a Canadian physiotherapist. We're just outside of Ottawa, Ontario, so way north from you guys. I just start by saying that we are a little bit behind you guys in terms of our curve. We're about 2 to 3 weeks behind, so our preparations are probably a little different than what you have faced so far. We have 4 rehabilitation sports medicine clinics in the Ottawa Valley. We've been, like you guys, forced to mostly close our operations So we've done sort of a four-prong attack, where the first thing we've done is we've established our urgent care services. So in 3 of our clinics, we offer urgent care for people that have conditions that are likely to worsen, conditions that may lead them to hospitalizations, post-operative patients, and certainly frontline healthcare workers. So we're trying to prevent these people from getting into hospitals or having to go to hospitals for other reasons, and freeing up our physicians so that they can be working in the local hospitals. The second thing we've done is we've approached our local hospital, and we've rostered our physiotherapists with the hospital, so that we can help empty the hospitals, create more bed space, reactivate patients much faster. And once it reaches us and we get to a critical mass of people that need to be hospitalized, that we're going to be part of the solution there in helping them out. And it keeps our physiotherapists busy and involved in this process as well. We're looking into telehealth. We've really haven't started yet. We live in a small rural community, so there's not as much of an appetite here for that. However, as people become more isolated and their needs are going to be greater, so we will be there with some format of virtual care for them. And the fourth part of our plan is looking at how are we going to come out of this. We believe that things will be far different than they were pre-COVID-19. The patient population will be different, in that I think there's going to be a lot of reactivation that's going to be required. And I think we're not foolish enough to think that as soon as somebody turns on the switch and says you can go ahead and operate again, that things will be exactly the way they were. Our treatment settings may need to change. There may still be some distancing that's going to be required. So we're really putting a lot of effort in looking into who do we want to be and what are we going to be once the patients are allowed to come back into clinical setting.
Great. Thank you so much, Patrick. And thanks again, Kimberly. And again, guys, my name is Josh D'Angelo. I also have the fortune of being the CEO of MovementX. And at MovementX, we've been working over the past few years to develop a bit of a different model, a model that eliminates a lot of the traditional pain points for patients and providers. And our model from day one has been built upon flexibility and transparency and autonomy. And so I think we're in the fortunate position that we were pretty adaptable as things have changed a lot during the COVID-19 global health pandemic. Our response and action, to give you guys a bit of background, and we're based out of both Washington, D.C. and Portland, Oregon, though we have a couple providers that are spread out, a couple in New York and even in California. Our response has really been guided with 3 kind of guiding principles, I'll say. Number one, first and foremost, what we're concerned about is how do we maximize the safety of our patients, of our providers, and our community? And how do we do things and make actions that are quickly and decisively in that interest? And then the second guiding principle for us was how do we make decisions that are in alignment with our mission, our vision, and our core values? Our mission at MovementX is to help people move their best so they can live their best. And one of the beautiful parts about that mission, and I know with what all of what we do, is that can be done in so many different and diverse ways. And so really tapping into the creativity in pursuit of our mission. And some of our core values, we have 4 core values in particular that I'll cite. One is a sense of community. How do we take actions that really not only serve to protect the community and safeguard them, but how do we take actions that add to the strength and resiliency of our community? The second one is empathy, looking at how do we make decisions and really ask ourselves, can we put ourselves in our patient's shoes and understand what they're going through right now? Can we put ourselves in our provider's shoes and make decisions that we think are as empathetic as possible? Our third core value is a sense of passion multiplied by purpose. So how do we take this passion for physical therapy, for movement health that we have, and drive it in a purposeful, united intention? And then the fourth business principle that we have is a Japanese word, actually, core value called Kaizen. And what it means is a process of continuous improvement. So the reality is for us guys that we actually had not done any telehealth sessions prior to about a month ago. but even now taking the mindset of how can we continue to deliver the best services possible for our patients to keep them healthy and keep them moving well. How can the second telehealth session be even a little bit better than the first? How can the third be better? How can the fourth be even better than that? So that was kind of our second guiding principle. And then the third guiding principle was, and I think Patrick spoke to this pretty well, how do we make decisions that are not only reactive in the short term, but that are good for the long-term success and viability of the organization so that we can continue serving patients not only now, but well beyond that time frame. And with the above philosophy, we really tried to be on our toes and lean into the challenge, lean into the obstacles that we saw coming ahead. So starting about a month ago, we swiftly and decisively took 3 actions. Number 1 was we started encouraging all patients to move over to telehealth sessions, and we quickly built up the infrastructure to do so. Number 2 was we tried to introduce a creative session, what we're calling a social distancing session. So we'll still go to the individual, but we'll maintain a 6 to 10 foot distance from them at all times. So it takes one more step to being there in person while also maximizing the safety of the patients. And then the third thing was to implement max safety precautions for those patients that we're still seeing in person. So making sure that our providers had the necessary PPE, even if they were just going into someone's home to protect both them and the patient. But I would say at this time, we're doing mostly telehealth and social distancing sessions. We also really tried to ramp up our internal communications for our providers and for our community. I think the reality is right now there's a lot of confusion at this time. And so consistent and clear and concise communication is extremely important. So we've tried to deliver messages to our providers and our community on a daily basis every single morning. The last 2 changes that I'll mention is one, we're also doing an exercise class that was in person, predominantly geared toward older adults over the past few months. And obviously the reality now is that older adults are one of the most at-risk populations. Not only are they at risk for the disease and some of the more detrimental side effects, but they're also at risk because now they're at home and there's a greater likelihood that they're sedentary. And so we're moving that class actually digital, and we're going to start a fundraiser around that class. We're going to offer it, and we're going to donate 100% of proceeds back to a charity that's securing PPE for our medical heroes, and many of whom I know are PTs at this time as well. And then the last thing is what we're doing for our providers. And we've tried to build up a lot of infrastructure for our providers to ensure that they feel empowered and supported even at this time. And we've actually recently seen a small increase in our provider applications. And so what we're doing is trying to figure out creative strategies of how at this time we can open our doors to new individuals to come on board who are fired up about the mission, fired up about the vision, and want to be part of the solution. And I guess I'll wrap up here as we transition into the question and answer section by saying that if we can focus on the building of our community that does our best to keep our patients safe, and if we can be a creative force, I think we have the ability as a community, as a profession, to come out on the other side of this, hopefully stronger, hopefully more united, hopefully very, very well prepared to serve our patient base heading into the future. So with that being said, let me open it up. Kimberly or Patrick, anything that you want to add at the moment? And if not, I'll dive into some questions.
Go ahead, Patrick.
Go ahead, please.
I was just going to say you did a very good job of talking about your mission and vision. I would say I have to agree with pretty much everything that you're saying. We really always traditionally in our clinic have focused on building community and kind of being there to serve our patients. And so everything that we're doing, our telehealth visits, we are offering at a really steep discount. And so one of the questions on the side, it looks like, is if telehealth is not billable there in Connecticut. In Georgia, we're still not sure what's going to happen with that either. So right now we're just offering it at a very steep discount so that we can still provide care because our patients are still our patients. And even for those who are not able to come in to the clinic, if they're not, we're seeing a few post-op patients who kind of started before this all happened because elective surgeries have all been canceled, I'm sure, kind of all over the country. But we want to make sure that we're still taking care of everybody. And so even if we're not seeing patients with telehealth, if we were seeing them at the time that this all kind of ramped up, we're still making calls and checking in on them and making sure everybody's okay. But the live stream class that I'm doing every day is all pro bono. So we're not collecting fees from anybody. It's just an offering that we wanted to keep everybody active and kind of stay healthy together. We do have a GoFundMe page. GoFundMe is matching up to $500 right now for small businesses. So if people are so led, they can certainly make a donation for us. But other than that, it's just our mission and our responsibility as healthcare providers. And like you said, Josh, if we're all in this together, which we are, as we've always been, we can make a big impact on the health of our population altogether.
Yeah, I think you guys hit the nail on the head with talking about the community, and it's the same thing that we're trying to do here. When you were talking about reaching out to your patients and all that, we've had all our therapists come in early on as soon as we were basically forced to mostly shut down, and all our therapists have been in contact with their patients and making sure that they are they're still healthy, that they're managing well, and those that needed help in one form or another, and we were able to provide that. The one thing I will say is that one thing that we're really pushing in our community, but also across Canada, is that physiotherapists, or I should say physical therapists, really have a big role to play in all of this, in not just keeping people healthy from a musculoskeletal standpoint, but also we have a lot of skills in terms of pulmonary rehab, chest physio, and all of that. And I think that I think everybody is going to have to look at their own practice and make sure that they brush up, and that's part of what they're going to be on the other end, because I do feel like patients are going to present in a very different way than they did in the past, and I think that's going to be an important part of what we're going to be going forward. And I would hate for physical therapists to have to take a back seat to other professions who are encroaching and onto what we normally do, or we should be able to do, and lose out at the end. There's a big opportunity there for our profession, and I think it's there to be seized. So it's going to be important to do so.
Well said.
Yeah, very well said, Kimberly and Patrick. And I love something that both of you said, which is coming from that empathetic perspective, even starting just checking in with our community members, checking in with our patients. That being said, checking in with our friends and family. This is something that we're all going through together. And the more that we can be there for each other, the more supportive we feel, the better able we're going to be to manage it. So I love that perspective. One of the questions that it looks like we had on the comment thread, and please, again, if you have any questions at all, don't hesitate to ask and put it on the comments. One of the questions we had is, are we going to be discussing anything about face-to-face visits, or will it be centered all around telehealth? So I wanted to toss out the question, do you guys have providers who are still doing any face-to-face sessions at this time?
We do. So we're providing, as I said, urgent care. Our professional college has been very stringent as to who fits under these criterias, and we're certainly abiding by that. We've also, as you mentioned, provided the proper PPE. The clinical setting has changed completely. There's no waiting room. People come in and they wait in the parking lot until it's time for them to come in, and it's extremely stringent. Everything is wiped constantly, but we do provide treatment to those that need it on an urgent care basis. So there is still some one-on-one treatment going on.
Yeah, we are also, a couple of us, there are 7 therapists. Not everybody is full-time. We have several part-time treating therapists for our clinic, but we have 2, maybe 3 of our therapists seeing patients in the clinic who, like I said, are post-op and really, really need that hands-on care. And so, like Patrick said, we don't have the waiting room thing happening. We ask patients to wait in their car, no family members coming in unless it's a minor and they absolutely have to have a parent there. And we're keeping 1 or maybe 2 therapists at a time in the entire clinic with their 1 patient, so that we stick to a section, and that's where we are. And we're not going to go from this place to this place, to different stations, and any equipment we need, we bring there and then leave. And then everything gets doused, with the bleach solution afterwards. And we also have a couple of therapists going to patients' homes to see them for mobile visits. That's something we actually already had set up. We see mobile clients, so that was an easy transition there, just to be able to move patients from clinic-based to in-home if it was something they really needed that ongoing in-person care. Most of those individuals are people who need guarding. So they have underlying conditions or they're elderly, and because they're a fall risk, doing something with them via telehealth where they potentially could fall or not guarded, that wouldn't be safe. So their safety is obviously our first concern. And then obviously following all the hand washing guidelines, and having masks if available, to be around the patients, because we don't want to make sure that they're a vulnerable population anyway, so we don't want to put them at risk.
Yeah, and I think so much of it is centered around that notion of how do we keep the patients as safe as possible? How do we keep our community as safe as possible at this time, and doing everything within our power to be able to do so? And so even asking the question, you know, am I putting this patient at more risk? Do I have the potential to do more harm by seeing this patient? If there's any thought in your mind that the answer might be yes, then we opt for a safer route, speaking internally, at least for us. But for those patients who absolutely need it, you know, their function in the future is critical and hinging upon us coming and seeing them in some aspect or delivering some service in some aspect, then it's important to ask the question of how can that be done as safe as possible. Kimberly, I was curious to toss back to you, and the question of one of the questions we had was how do you set up for those home visits? So I know you guys were set up for them prior to starting going. You were already doing mobile visits, but what does your process look like for documentation and even payment processing?
So our clinic, we are mostly out of network, an out of network provider. We're in network with Medicare and Blue Cross Blue Shield. We also have a cash rate, so that applies for our in-home mobile clients. So we use Clinician as our EMR documentation and billing system. So we just document as we would in just our place of services as a mobile client instead of an in-clinic client. So that platform hasn't changed for us. We do have a travel fee. Normally speaking, it's higher than what we're charging now because people who would normally be coming to the clinic are having to be seen in their homes. We don't want to put a financial burden on them. We want them to continue care. So we're discounting that considerably as well, so that we can just keep providing care for them. You know, right now, it sounds like none of us are really in this for the money. We just want to provide care and have our services and our overhead kind of covered. But right now, we're just all trying to make sure that our patients are getting what they need. So that's how we're set up for that.
Great. Yeah, and I think you're absolutely right, Kimberly, that right now it's all centered around patients, community, keeping our patients safe and still delivering effective services to help our patients move well. Patrick, I was wondering if you might be able to speak to a little bit more about how you're controlling the environment in your clinic, and then if you guys have had some discussions about doing home visits, what that discussions have looked like.
So we have not addressed home visit. That was not part of our business model prior to all of this. There are some services. It's structured a little bit differently, I suppose, in Canada, where those services are offered publicly. There are some private providers that do strictly home care. So it's not, for us, especially in our area, not a very big market. So that's something that we have not addressed. We also, I mean, there's a bit of a shortage of physiotherapists in our area. So deploying people on home care is also, you know, very ineffective from a critical mass standpoint and a business standpoint. So that's not something that we've done before. And we did discuss it once COVID-19 presented itself. We did discuss it with our therapists, and there wasn't very much interest. I think there's concerns about, you know, in-home safety. What are people actually able to provide? But as I believe that up till now, the public services are still available. So it is being addressed. So there's not as much of an issue with that segment of the population in our area.
Yeah, and I think that makes good sense. One question on the comments was, how can you manage, or how can you best control the home environment? You know, Patrick, I think you spoke to some of the challenges there. You know, I know from our perspective, we've just made sure that our providers have the necessary PPE everything possible to maximize their safety and the patient's own safety. Everything from having booties that cover shoes to having appropriate personal protective equipment, from masks to glasses to gloves, et cetera, et cetera. And so doing the best you can while still keeping the patient as safe as possible. Patrick, I wanted to jump back to one of the conversations that you were alluding to, and I think you have a unique perspective here. Some of the conversations that we've talked about internally at Movement X is how do we elevate the healthcare system's capacity at this time, right? We talk a lot about the concept of flattening the curve and trying to prevent as many people from getting as sick and needing hospital-based services. We came up with a term internally of also asking the question, how do we raise the bar? How do we raise where that critical threshold is, where hospitals become overwhelmed? So what strategies are you guys taking to be able to maximize healthcare capacity at this time?
So we addressed a little bit of that with our urgent care. So we're trying to, locally, all the physicians have remodeled their practices where, they went on rotations where 3 physicians will be looking at inpatient care and rounding on patients. Others will be in emerge, and the others will be doing in-office type stuff and some telephone medicine as well. So from our standpoint, we want to keep them out of the doctor's offices because they have minimal staffing there, and we want to keep them out of emergencies as well. And it's important also right now to remind you that we are behind where you are, so we are bracing ourselves for what you're probably facing currently, and we're trying to learn from what you have done as well. But as far as improving the capacity, that's why we reached out to the hospital. We submitted a proposal to them to say, hey, why don't you let us come in here in your hospital and help your departments and see if we can get people out from that are currently in the hospital, shorten their stay. It's a very small department. They have 3 full-time equivalencies. So now we've raised that to close to 9, at least available, 9 therapists to be able to work. So that has raised the bar, if you will, or has raised that critical mass of services that can be offered. And what's happening too is that big centers are sending back expat patients that were in bigger centers, and they're sending them back home, whether it's post-surgically, although here as well, elective surgeries have been canceled, but they're shortening the stays in big centers who are bracing themselves for the COVID-19, sending patients back into smaller communities. And that's where we jump in, get them better, get them home, and reduce their risk, and everybody else's at the same time. But it's been a great partnership. I think I can speak more to maybe a Canadian physiotherapist, but there tends to be a little bit of a divide between private and public physiotherapists. No animosity or anything. I don't want to present it that way, but definitely very different in terms of approach and the type of care in hospital on a public sector versus private practice. And in this case, everybody's checked their egos at the door, and everybody is working together. And there's just one common goal, and it's to make sure that we keep our community safe and that we can get people in their homes as opposed to hospitals. So it's been a great experience from that standpoint.
That's awesome.
Yeah, thank you so much for sharing, Patrick. I think one of the neat aspects of that is the collaborative nature of that, and us finally crossing different silos to be able to work together to best take care of the public. And I think there are a lot of lessons that can be learned for that as we move forward into the future. And it even reminds me, Kimberly, of the classes that you guys are holding, trying to keep people well and trying to keep them at home exercising in whatever way that you can. One of the questions that came up is how do you manage the liability for that? Do you have them sign an online waiver, or do you take any other strategies?
We actually don't right now because it's not physical therapy treatment. It's just an avenue for people to exercise as if they were watching, Beachbody, doing Beachbody workout, videos at home, or going outside for a walk. We recommend activity. We make, as PTs, we make activity recommendations and exercise recommendations. And so this is just an avenue for people to be able to exercise. I do give kind of cues on form, but again, just like any exercise instructor would. So because I'm not having a touch point with people, because it's a live stream, I can't see them, I can't see what they're doing. So, really it's up to the individual to make sure that, and I constantly remind them, if this is too much for you, if you have pain, stop, march in place, skip this one. Of course, we are still available as practitioners to help them. So we are available if they want to call, if they have any questions, if they're feeling pain with anything. They don't have to just deal with pain just because we have a pandemic right now. We can still reach them and be available to treat them as therapists, but that's separate. We're using a different platform for that, where we're doing an initial evaluation as well as we possibly can via telehealth. And I noticed one of the questions was, what platforms are you using? There's a platform called doxy.me. So it's DOXY. Are you guys using this? .me?
We are not, but I'm familiar with it. Yeah.
Okay, so that's what we've been using. If it gets glitchy, the CMS has said that you can use sort of less HIPAA secure platforms like FaceTime and Skype right now. I'm sure they'll give us some more restrictions as time goes on, but so if it gets glitchy and we're having trouble, then we're switching over to FaceTime or Skype. And truthfully, with a lot of our population, they're used to FaceTime is, kind of ubiquitous. A lot of people are used to FaceTiming with their grandkids or, whatever. So as long as, and that we do get a verbal from them that you are okay, that this is not a secure platform. And we have separate telehealth paperwork that we have had everybody who's transitioned to that platform sign, saying, that yes, we're doing telehealth. We know that these are telehealth services, that they're okay with our billing, which again is just cash right now, and it's been steeply discounted. If insurances are going to start paying for it, then we'll probably submit to their insurance company if we're in network with their insurance. But that they are okay with using a less secure platform if the one that we're trying to use that's HIPAA compliant is not working for some reason. So.
Yeah, thank you for sharing. I think, and your strategy for telehealth is very similar to ours. Have a plan A, plan B, plan C. And even, for us, it's the same. We use a Google Meet, a HIPAA compliant version of it, but now with FaceTime being acceptable to use, we always use that as a backup. And I've had even patients who are 93 who are resistant to trying it at first, afterwards at the end of their first session say this is much easier than I thought it was going to be. So we're seeing some early successes with that. And I think we're seeing actually a couple themes arise. Obviously the theme of safety is so big and so important. That's on the forefront of everyone's mind. The second theme that I'm seeing coming up is communication, reaching out to our patients, reaching out to our physician collaborators, right? Reaching out to communities via telehealth, saying, if you have any problems with this exercise, please let us know. We want to be a source of information, of education, of engagement and empowerment at this time to put our best foot forward and be able to assist the public as much as is possible.
There was a question earlier that I saw go by, and it asked, do you think that the future of PT is through telehealth? And personally, I don't think it is. I do think that we separate ourselves from other professions with our hands, with our approach, with our manual therapy, with the one-on-one empathy, the reassurance, and what we do for patients. I think there's always going to be a major role for that within our practices. I do think it's going to be part of the new reality, but I think it'll be one more tool. It'll be something that I think as the population becomes more and more savvy with electronics and there's been so many Zoom meetings and Facebook Lives and everything that people are now participating in. I think that it's going to quash maybe that fear of online services, but I think that ultimately that physical presence will always be a big part of what we do. And I also think that if too much of our businesses, if too much of our profession moves to an online platform, I think that's how we can be much more easily duplicated and replicated, and and pushed out of the continuum. So I do think that when we come out on the other side, we have to be present on a one-on-one physical assessment and treatment platform for sure.
100% agree. Yeah. We have a population, probably you guys too, where people tend to travel for work, normally speaking. So they'll be gone for a week or two at a clip because they're traveling to wherever and seeing clients in whatever business they are in. And I could see it as being a really good way for us to continue doing treatment while they're gone. Obviously more exercise based, but while they're out of town, we could still do a session, even if it's just, if we're normally seeing them twice a week, maybe just once that week, we're going to do a telehealth session that's, maybe half the time that we normally would, just so that we're getting a session in with you so that they are continuing care and not just, nope, I traveled and I didn't do any of my exercises and now things hurt more. So I agree. I think it'll be a tool moving forward, but I don't think it's going to take over our practice.
Yeah, and there's some great early research, for example, with total joint replacements. I believe the article looked at knee and hip replacements, and it demonstrated some validity for telehealth in that article. It wasn't a huge sample size, but I think that certain conditions, individuals might be more willing to transition to telehealth if they had a comfort with this at baseline, or if a clinic is offering this. One of the strategies that we utilized early on was, as soon as we kind of realized what trajectory we were on, was accepting that this is likely going to be our reality for the next 2 to 3 months. What else will likely be true? There's going to be a quick rush over to telehealth. What does that mean? Okay, more people are likely to be building their comfort with digital tools, whether it's through events or even healthcare. Okay, so if this is likely going to be a long-term solution or a short-term solution that will be an option in the future, how can we put infrastructure to it to make it meaningful and to ensure that we're providing good quality care with it? One of the questions that popped up, I think it's a difficult question. It's a good question, but I want to make sure that we face it head on, is how have you managed reducing staff? Have you guys furloughed employees, or have you applied for small business loans? Does anyone want to speak to how they've managed the business side and the financial side of this pandemic?
Well, it's our reality is probably different than yours, given that we have completely different governments. But for business, we've had to lay off a lot of employees. There are government subsidies that are available to businesses and to individuals, so nobody is left in the dark. So that has been good from that standpoint. But basically, as a business, I think the reality is that the next 3 months are going to be very difficult. We're going to be operating at a great loss. And I think you were absolutely right earlier when you said that we're not in it for the money for the next few months. I think that the currency that we're trying to deal in right now is basically getting a lot of social credit from our community and building relationships with our patients and with our patient community. That's been mostly the currency we've been going after since we've been closed, and trying to be there for our community, because no amount of telehealth and a discounted telehealth and few urgent care that we're doing is going to have any kind of significant impact on the bottom line. We've basically accepted the fact that we're going to be operating at a loss, and that's why we've concentrated on what are we going to be on the other end of this.
Yeah, thank you for sharing, Patrick. And for us, we have been, again, I mentioned the word adaptable. We have been fortunate to be adaptable in these circumstances because we did not have a brick and mortar. So there's not a facility that we have to continue to pay rent on. We center ourselves actually around a tech platform, and that has enabled us to keep overhead as minimal as possible. So we've been fortunate that we haven't had to lay anyone off, but nonetheless, there are still a lot of changes that are happening. And one of the questions was around small business loans. And there's a program going on right now called the PPP, or the Payroll Protection Program, That's a small business loan through the Small Business Administration that is likely going to be forgiven if you take the appropriate course of action. The challenge has been for us, at least internally, is the demand for it is so incredibly high that the opportunity to get attention, get questions answered, to be able to successfully even apply for the program has been somewhat limited. So most banks are only accepting right now their own customers to apply through them as a lender. And so we face some challenges. I have to give a shout out to Keaton Ray, our COO, was applying to through as many different avenues as she could last night. So there are some small business programs, small business loans that can be helpful at this time on the United States side. All right, another couple questions here. So let's see. What documentation do we need to do to ensure an evaluation completed by telehealth session holds up to review, especially given no hands-on? So I think that's a great question. How do we maximize the telehealth experience? Kimberly, since you guys have started that, do you want to jump in there?
Sure. So the first kind of half of that question of how do you complete an assessment via telehealth, obviously we're not putting our hands on them. So you're not getting information like joint play and temperature and things like that, but we can take a look at how people move. So if you're familiar with the functional movement screen and selective functional movement assessment, that's something that we employ in our practice regularly anyway. All of our clinicians, if not certified, are at least familiar with it and utilize it quite a lot. So we can take them through movements and kind of grade them based on that because there's a grading system. But even if not, I mean, if you have a cervical patient and you just have them go through range of motion, then you're going to give your best judgment as to, if not degrees, then at least percentages of how they're moving and whether or not that movement is painful. Are repeated measures or repeated movements painful, or increasing pain, reducing pain, that type of thing. We had one therapist who did a hand evaluation via telehealth a day or two ago. And because she is very creative, she had the person hold their hand up in front of the camera, and she has goniometers at home, because most of us have been to conferences where you just like grab gonies and tape measures and stuff. And so she just held it up to the screen and got a range of motion measurement based on how the person was moving their hands. So, I mean, we're all trying to figure out the best way to get as much information as we possibly can. Obviously we can't do strength, but can a person go against gravity? Or, if you're measuring strength of the quad or the leg, can they do a sit to stand on one leg from a chair? So there are kind of functional ways that you can take a look at how strong a person is, even if you're not giving them a manual muscle test grade of, 0 through 5. In terms of guarding and liability and all of that, if you're going to ask somebody to stand on one leg, make sure they've got a counter to hold on to. There's a lot of moving around the space. So we've been doing our telehealth appointments for the last few weeks. We kind of jumped on this fairly early on. And there's definitely a lot of, angling the phone or angling the computer. Like, can you see me? Okay, here are my legs. Here's what I'm doing. Or now I'm going to lay on the floor and take my computer with me so I can show them what to do. And they're doing the same thing. So I think everybody's really adaptable, and everybody understands this isn't ideal. So everyone's just kind of rolling with it. We haven't had any pushback about that. And in terms of documentation, we have created a template in our EMR that's specifically for a telehealth daily visit or a telehealth initial evaluation that has telehealth language in there saying that this was all done via telehealth. And so obviously we can't do XYZ, but these are the measures that we have, and this is what we can see. So you can get a great deal of information from people in that way, as long as you're just documenting this was all done via telehealth platform. There was no hands-on treatment, but advice was given. Patient was taken through XYZ exercise. They had a good demonstration, good form of the exercise, and good understanding, and then here's my plan of care. So you're changing around what you're saying a little bit just so that it's very clear what you're doing, and that it was not an in-person session.
Yeah, and one note is that we've had a number of questions about billing as we've gone through the conversation. And if anyone at home has questions specifically about billing, feel free to email advocacy@apta.org, or visit apta.org/telehealth if you want more info centered around billing. We have some great experts who are doing a lot of wonderful work to be able to inform the public here as much as possible. And I love all of what you said, Kimberly, and I think a couple of thoughts come to mind that I wanted to share as well. We've had a lot of conversations around telehealth and being such a hands-on profession. How can we make sure that we're delivering the same value? And it really starts with mindset. And I think a couple of things have helped us. Number one, I think back to the importance of the subjective exam. There's a great quote by, I think it's by Mackenzie, one that a friend of mine, Ifosa Guabadia, loves. He says that if you listen to a patient, they'll tell you what's wrong with them. If you listen to a patient for long enough, they'll tell you how to fix them. If you listen to a patient, they'll tell you what's wrong with them. If you listen to a patient for long enough, they'll tell you how to fix them. So don't discount the importance of the subjective exam, especially if we have the opportunity to have more time with our patients. There's so much information that we can gather. And then the second piece of it was a great quote that I think Fred Gilbert came up with on the spot. Fred's chief people officer, also a physical therapist with MovementX. And we were having a conversation around mindset. And he said, remember that the hands don't know what to do unless the brain tells them what to do. Right. So really what people are paying for is our mind, our education, and that we have the ability to provide education and resources and guidance through virtual platforms right now. So let's lean into it the best that we possibly can and continue to support our patients and clientele.
Very good.
Okay. And I think I would love to focus kind of the last few minutes of conversation here around looking ahead into the future. Obviously, we know here in the States we have a challenging couple of weeks ahead, as we expect things to rise towards the peak. Patrick, I know you guys are a little bit behind us and hopefully have been able to take some lessons from the experience here. I'm curious, we've talked a little bit about how telehealth is likely going to be an option in the future. What else do you foresee as changes that will be made after the pandemic as we get to the other side of this? Patrick, you talked a little bit about respiratory therapy, and really understanding the mechanics and the nature of COVID-19 and how we can really address the movement system and make sure that we understand how this particular disease has impacted us. So I was wondering if you might be able to kickstart that discussion and dive a little bit more into any thoughts on the treatment techniques or what patients might be seeking, as well as how is the landscape going to change even more significantly as we move forward?
Well, on the cardiopulmonary part of things, I think obviously this disease is all lung-based. So I think at the end of this, people are going to be inactive, especially once they've contracted it and they come out of this. They're going to have some chest expansion issues. They're going to have some deconditioning issues. And I think that what we're looking at is to say, okay, what kind of transition type of facility can we be where we're going to be looking at patients that are either coming out of hospitals or even if they've contracted the disease and they're at home, they're still going to be severely deconditioned and God forbid they've had any other predisposing conditions where they're going to be, even further behind the eight ball from that standpoint. So we're looking at providing services that are going to be the transition between, having not done anything, having poor lung capacity to, being healthy and being able to move around and do, the things that you need to do at home. So I don't think that we'll have to change our practice to, do drainage and those kinds of things. But in terms of chest expansion, chest mobility, spinal mobility, those are things that are probably easily adapted into more of an MSK type of caseload or a physiotherapist to expand their expertise to address those issues. One of the things that we don't know is how people are they going to be afraid to come out into the community? How long is it going to take for them to trust being in public settings again? So that's something that we're trying to look into and say, okay, well, are we going to need to modify our treatment areas? We certainly use private rooms, but we have more open areas, be it in a gym, be it beds that are one next to another. Are we going to have to put up barriers? Are we going to have to be distancing them more? So those are all questions that we're asking ourselves. What are we going to need to be doing on the other end of this to get back into offering services as soon as possible?
Yeah, a quick anecdote that I want to mention as well. I think you hit the nail on the head there, Patrick. We actually had a patient, one of Keaton's patients, who I mentioned earlier, who's our COO, and she was doing some wellness with a client of hers who was 80 years old, and they would do a lot of weightlifting, resistance training, and she said he was doing great before all this started. He was back squatting 100 pounds. He was, deadlifting. He was doing really well. And she, as everything came down, obviously they stopped doing in-person sessions, and she reached out to him a couple times and said that, let's start telehealth. I think you would really benefit from it. But he was a bit resistant to it. And finally, after it's been about a month now, he reached back out, I believe, last week and wanted to start something. And so he has a few dumbbells and a few resistance bands lying around. And she said, for this man who was back squatting 100 pounds before this all started, just after 1 month, he was having trouble using 10-pound dumbbells because he hadn't been resistance training. And so that's a question that really begs of us, what is the public, what is society, what are individuals who are more likely to be at higher risk for muscle atrophy and deconditioning? What are they doing right now, and what will they look like on the other side of this? And how can we be a trusted resource for them moving forward as patients realize that they might have a greater need than they do when they're in their homes all day long?
If I can add on to that, Josh, kind of in terms of, where we see things going and coming out stronger and thriving on the other side. So as I said, our clinic, we focus on health promotion and injury and disease prevention. And in every single one of our initial evaluations for our kind of rehab patients, we also see patients for kind of health promotion and prevention, what we've typically called wellness, where we're looking more at like healthy lifestyle and coaching, and then exercise based, because that's our niche. But in every single one of our evaluations, we have questions that address elements of a healthy lifestyle. So how do you get 150 minutes of exercise on a regular basis per week? Do you eat at least 5 servings of vegetables and fruits every day? Do you get at least 6 to 9 hours of sleep on a consistent basis every night? And in the last 2 weeks, rate your stress level 0 to 10. We want to make sure that we're touching on all of those. And if there are any flags in those questions, we can take a deeper dive. And it's part of treatment. So as over the next several sessions, that's something that when you're with your patient, you're having conversation, that's part of the conversation. Helping them realize how their lifestyle not only impacts what they're in for right now. So whether it's because they've had chronic pain or acute pain, or they've had a surgery, there are certain lifestyle factors in place that have A, led up to that condition, and B, will affect their ability to heal from it. And I think right now, so I'm a part of a group called the APHPT, which is the Academy of Prevention Health Promotion Therapies, primarily PTs and OTs, some PTs as well. And kind of a conversation that we've all been having is how important is baseline health right now? Part of the reason why the U.S. is being hit so hard, and younger population is being hit so hard in the U.S. with this disease, is because generally speaking, as a population, we are much in poorer health. So even people in their 30s have high cholesterol, high blood pressure, high blood sugar. Even if they're not diagnosed as diabetic, or maybe pre-diabetic, they don't know it. They're carrying around too much weight. They don't exercise. They're not eating enough plants, and things like that are they're really putting people at risk. They're putting us as a population at risk. And so, baseline health is always important. This is always something that we've sort of been shouting from the rooftops. But right now, the best way to protect yourself, other than the social distancing and things that we're already doing, is to make sure that you are in the best possible health that you can be in. And so I think as a profession, that's going to be something that, there's sort of this rising tide within physical therapy, that there are more and more of us saying this. And if we're all saying it and all talking about it, and not just leaving it to physicians who very often, unfortunately, don't talk about it, maybe people will start to listen and really hear us and maybe start to change some behaviors. I think that this pandemic is obviously going to affect us as a population in a way that in 100 years people haven't been affected. And I think that baseline health conversation is going to come to the forefront. In all the news feeds, it is coming to the forefront, and I think it's going to continue to be a part of the conversation. So as physical therapists, where are we in that conversation, and how are we positioning ourselves to be able to address that effectively with our patients and with our communities?
I love that perspective, Kimberly. Thank you so much for sharing. And 2 quick thoughts, and then we'll go around. I know we're running short on time for final comments from each of us as we start to wrap up. But I think a couple of truths from what you said, Kimberly. Number one is we're going to have to be movement system experts better than we ever have before, and more comprehensively than we ever have before. Not only looking at respiratory function, but also looking at sleep, also looking at stress and anxiety, right? That's one of the biggest challenges that is out there in times of uncertainty. So how can we comprehensively examine for all of that, bake it into an evaluation, and give tangible, palpable action moving forward? And if we can do that effectively, we actually have an opportunity here to further separate ourselves as a trusted sort of information, a source of information and education for the public. And then the other thing is another quick anecdote I'll share. I was talking with a physician recently, a primary care physician, who said that, we've always known how important exercise is, but we've had challenges in that we say, okay, you should go to a personal trainer or go to physical therapy for 12 sessions, and then that's typically all they receive, and they fall into the same patterns at home. So what sort of creative solutions can we make in order to be a solution, be a place where patients can come for sustainable change? I think that'll come up to the forefront of the conversation as well. With that being said, Patrick, I'll hand it over to you. Any final comments, any final thoughts that you'd like to share? And also, if you wouldn't mind, please telling us how we can get into contact with you after the conversation, if there are any more questions out there.
Well, first, I'll say thank you for having me on this Facebook Live. I hope I was able to bring some good ideas for some folks. The final thought for me is, I guess, one of our, you use the word guiding principles. The first thing we did is we asked ourselves, when this is all going to be over, how do we want to be remembered? And I would strongly encourage everybody to ask themselves that question. And to me, that's a bit of a call to action, and say, what can we do? How can we be of help to our communities, our patients, and ultimately to our profession? So that would be my final thought. So again, thank you very much for having me. And if you wish to get in touch with me, you can reach me by email, pkn at obphysio.com. So hopefully I'm doing this right. There you go.
Thank you, Patrick.
So just to reiterate because there's a question on the side about the organization that I mentioned, it's the Academy of Prevention and Health Promotion Therapists, or APHPT, and they're at aphpt.org if you want to take a look on the web. I work at a step ahead physical therapy in Roswell, Georgia, and we are at asaphysicaltherapy.com. My email is kim@asaphysicaltherapy.com if you want to get in touch with me. And you can follow us on Facebook. Like I said, I'm live streaming every day at 2:30. Of course, not today. I already pre-recorded a video this morning and posted it, so it's there for everybody. But Monday through Friday, we've got exercise videos going. They're about 20 minutes. And it's been a privilege to be on here with you guys and to answer questions and to be chosen as someone to have this discussion. So thank you all so much.
Thank you so much, Kimberly. And again, thank you, Patrick. And I know for me, one of the places that I find strength is by looking to people to the left of me, looking to people to the right of me. And at least on my screen, each of you are on separate sides. And so I'm so appreciative for the two of you joining us here today. And I'm so thankful for all the viewers at home. And I really believe that if we bring our creativity, if we really focus on safety, if we focus on delivering value to our patients and the public right now, then we may see some creative solutions moving forward. Again, my name is Josh D'Angelo. The last name is spelled with an apostrophe. And it does give a lot of challenges in life. But Josh D'Angelo, you can find me on Facebook or Instagram, DANGELO. I'm part of a company called Movement X. Our website is movement-x.com. If you want to reach me directly, feel free to find Facebook or Instagram, or just email me as josh@movement-x.com. If there are any ongoing questions, that being said, please feel free to leave comments after the fact in the Facebook Live and the Facebook video that gets posted, and or comments on social media, and I know we'll do our best to respond. But thank you so much again. Thank you for being an active part of the American Physical Therapy Association community. Thank you, Patrick. Thank you, Kimberly. And we look forward to seeing hopefully the positive change that we can bring about as we all encounter difficult and uncertain times moving forward. So thanks so much again.
Thank you.
Thank you. Bye.